Hi, this is Tom Goki from Orthopedic Educational Services. I wanted to review with you long-headed biceps tendon rupture. Quickly to review the anatomy of the shoulder girdle, the rotator cuff tendon structure is made up of the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. The cartilaginous rim that deepens the glenoid is called the glenoid labrum. The ligamentous structures associated with the shoulder are the corticoclavicular ligament, the acromioclavicular ligament, and the glenohumeral joint capsular ligament. The biceps tendon has two heads. The long head originates on the glenoid tubercle. The short head originates on the coracoid process, and they both terminally insert into the radial tuberosity of the elbow. It's the long head of the biceps tendon that goes through the bicipital groove underneath the transverse humeral ligament and then becomes interarticular and attaches in to the superior glenoid labrum inside of the joint capsule. The long head of the biceps tendon functions as a depressor of the humeral head. It helps to prevent superior migration of the humeral head along with the rotator cuff tendon and the glenohumeral capsular ligament. It has an interarticular attachment onto the superior glenoid rim. Mechanism of injury is usually a sudden forceful biceps flexion against a stronger opposing force that causes an extension type mechanism to the elbow. There's usually a sudden pop or a tearing type sensation that people will locate either to the anterior shoulder or the feeling of that tearing occurring in the shoulder joint itself. The rupture usually occurs within the substance of the biceps tendon and that portion that's intra-articular. Sometimes the stump may cause impingement symptoms or mechanical symptoms with shoulder motion. Clinically, the patient will present with pain, limited motion on active shoulder flexion, abduction, intra and external rotation secondary to pain. They'll notice a Popeye deformity, and you can see that here in this picture where the biceps tendon musculature, the biceps musculature balls up more distally in the arm, and that's as a result of this long head of the biceps tendon rupturing in the joint, and then that portion of the biceps associated with the long head falls distally into the upper arm region, and again sort of forms a Popeye deformity. There's usually marked bruising and discoloration in the distal humerus region. Sometimes patients will have some bruising that extends into the pectoralis or breast tissue, and initially they'll report weakness with elbow flexion or certain elbow and shoulder motions. Over time that will resolve, but that's usually an initial finding. There's not a lot of shoulder impingement symptoms unless, of course, there's a significant portion of that long head of the biceps stump that's retained intra-articularly that acts as a wedge or a loose body that impinges certain shoulder motions. There's no associated numbness and tingling, no associated elbow pain unless, of course, there's a distal biceps tendon rupture that occurs. Treatment for this is conservative. The majority of these cases will resolve over time, and the short head of the biceps that attaches to the coracoid will compensate for the loss of the long head tendon function, and people will resume near or near normal strength with elbow flexion. These symptoms will resolve usually in 4 to 6 weeks, but sometimes can vary from one patient to another. If a patient is having mechanical symptoms in the shoulder causing impingement or pain, then these patients may require additional studies like MRI or MRI arthrogram to assess whether or not there's a stump of the long head of the biceps tendon that has been retained. And in those patients, they would be considered surgical candidates to have that stump resected to minimize or resolve the impingement or shoulder pain symptoms. Patients will usually not require surgical correction for cosmetic purposes, although there are patients out there that may want that particular type of surgery. There's been no additional determination that by reattaching the long head of the biceps tendon in a tenodesis fashion provides any additional strength gains and does not contribute to any long-term improvement in overall function in the future. So in conclusion, long head of the biceps tendon eruption occurs from a sudden force on a flexed elbow. There's usually pain, swelling, and deformity in the upper arm with a Popeye type deformity. These patients will typically present with weakness in elbow flexion initially, but in the long term that weakness resolves. There's always an issue about cosmetic appearance of having a balled up biceps muscle in the upper arm. But again, those cosmetic issues does not usually warrant surgical correction. But certainly each condition, each case should be considered on a case-by-case basis. And lastly, treatment options are always conservative as far as resumption of range of motion, improvement of strength, and if a patient has a significant retained stump of the long head of the bicep, that may require surgical arthroscopy to remove that stump to improve function and to minimize pain. For Orthopedic Educational Services, I'm Tom Goki. Have a great day.